Chapter 10 is policy uncertainty during the Clinton administration, and I chose to do this video on healthcare problems and reform during the Clinton administration. Some healthcare problems. The American healthcare system revolved around employers and private insurance companies. Medicare provided healthcare for those over 65, and Medicaid provided healthcare for the poor. In 1992, 40 million Americans were uninsured. They were unemployed. Employers did not offer insurance. They exhausted their benefits due to a chronic or catastrophic illness, and they already had a pre-existing health condition. Clinton faced political barriers to reform. Insurance companies, physicians, hospitals, and drug companies would resist reforms that decreased their profits. Those without access were not politically organized and often did not even vote. Clinton's health reform. Private insurance companies would not be allowed to discontinue coverage for pre-existing conditions. The government would develop controls over the prices charged by pharmaceutical companies for existing and new drugs. The government would provide every American with a health security card to be used when seeking services from healthcare plans. Medicare and Medicaid would be retained, but their enrollees could join compelling plans offered by regional healthcare alliances if they wanted. Most employers would be required to fund healthcare for their employees, with some government subsidies. The federal government would fund the purchase of private healthcare insurance policies for unemployed people or part-time workers. The government would establish the basic minimum coverage to be included in all health policies, and regional healthcare alliances would be developed to publicize competing health insurance companies. So that's just a little bit about healthcare problems and Clinton's reform for healthcare during his administration.